An addiction is a physiological state. It's actually a disease state where the body becomes used to seeing a medication or a visual cue, and it requires that medication or visual cue to function every day. An addiction is often caused by either a single or repeated exposure to said medication or visual cue, and at that point the body, through certain receptors in the brain, requires that visual cue or medication. It can overtake someone's body because the cravings and the addiction cycle can make them feel like they need that just to function on a regular basis. There are certain receptors in the brain, and everyone is wired a little bit differently. The medications fill these receptors, and if these receptors are not filled on a regular basis, the patients often find that they need to acquire these medications to fill the receptors. There's a quantitative amount also, so everyone has a different number of receptors, but if the receptors are highlighted or activated in a small amount, it can cause them to function. Other patients need higher amounts of medications in order for these receptors to be activated. That's a very interesting question. It usually starts with the first thing in the morning. It's the first thing that you think of when you start your day. How do I acquire the medications, the alcohol, whatever it is that you're taking to get my day started? It's something that you literally need to get your first step out of bed. And unfortunately, it starts with that, and the entire day is chasing that. I think it's when they're preoccupied with something other than regular, normal daily activities. It's when they're sweaty, jumpy, nervous, not focusing on what most people function on for their daily routine, which is school, work, family, exercise. To them, their day starts, begins, ends, and goes all day trying to acquire these drugs. And addiction overtakes the rest of your bodily functions. When you become addicted to medications or alcohol, your body undergoes some physiological changes that requires repeated exposure over and over again to these medications or alcohol. It's very, very painful when you start an addiction because your body needs it, requires it, and it makes you feel absolutely terrible. Unfortunately, the pain also happens when you detox from these medications. The body has to go through major changes after it's seen these medications for a long period of time. We then, to detox them, there's a little bit of pain that is associated with it. Fortunately, the medications that we've been given in recent times have mitigated and lowered the amount of pain to go through a detox. But it's still not as comfortable as continuing your drug use. Compass Detox is a unique place. Our biggest advantage is that every patient has their own individualized treatment plan. Every patient is assessed when they come in with an intake. They see a doctor and multiple nurses, and then we create a treatment plan that is unique for them. There's no cookie cutter system here where everyone gets the same treatment. Everyone is taken care of with what they need, and we have a lot of experience and people that are willing to go the extra mile for each patient. Not that's just any other patient. Every patient gets individual treatment here. So that's a very interesting question. I think it really all depends on each case. Some of these patients come in with very fractured relationships with their parents. Some of them have good relationships. I think that's the role of a therapist to seek that out and explore that. We do family sessions here, sometimes remotely by telephone if the parents are out of town, or even on site if the parents are willing to come visit. We encourage the parents that if it's something that's constructive for each patient, once again, individualized treatment plan, we're happy for them to be involved and get involved with their child's care. It's very, very important here to save lives. and to get people on the right track, because we can really make a difference. I'm excited to be part of the Compass Detox team. This has really changed the way I approach things. I feel that you can make a difference in people's lives and save lives here. We've had multiple success stories that have really, you go home and feel like you've really made a difference in the world. I think this is just the beginning of the opiate and alcohol abuse problem in this country. I think that this is all going to continue for the next 5 to 10 years, and hopefully then we will get a control over it. But at this time, every day it's exciting to show up here and help people get on with their lives, and there's nothing more gratifying than helping people get their lives back together. But this is just the first step in the journey. This is the people that are the sickest and most acute. It is very important for us, after they leave here, to put them in the correct program so they can continue their journey to wellness.